Let's go over the personality disorder packet. So, personality disorders are clustered into 3 pieces. Cluster A is our odd or eccentric traits. So, our 3 in here are paranoid, schizoid, and schizotypal. So, paranoid. It's just like what it sounds like. We have a severe distrust and suspicion in others. Social anxiety, maybe in childhood, and a lot of jealousy and controllingness as adults. We're going to have a hard time forgiving others. And a lot of times they're going to adhere to schedules. We want to avoid being overly friendly because that will cause them to be suspicious of us. We want to use simple and direct language that is neutral and kind. Okay, and this is to prevent that distrust and suspicion. Some things we may do is for treatment is analytics, antipsychotics, and a big thing is we're going to want to choose one-on-one or individual therapy over our group therapy. And this is because the groups can trigger this client. So we're definitely going to pick one-on-one over group therapy. Our schizoid are going to be our loners. We'll typically have poor academic performance, disordered family life, depersonalization. We want to, again, avoid being too nice or friendly and do not force socialization. We want to respect their need for isolation. Once again, individual or one-on-one treatment before group therapy. Antidepressants and second-gen antipsychotics for these guys. And then schizotypal, we have anxiety in social situations, some rambling, paranoia, suspiciousness, anxiety, distrust, intermittent episodes of hallucinations and delusions, so that's a key one in that. And they're also prone to our magical thinking, things like that. So these are our Kool-Aid drinkers. That's how I just distinguish them from schizoid. Again, monitor for SI and respect the need for social isolation. We want supportive psych, low-dose antipsychotics to help with those hallucinations and delusions. So that's our cluster A. Our cluster B is our dramatic, emotional, or erratic traits. We have our antagonistic, or I'm sorry, let's do this. We have our antisocial, borderline, histrionic, and narcissistic. Our antisocial is going to be characterized by antagonistic behaviors. So that is doing the opposite of what is told of us to do. These people are going to have a profound lack in empathy and an absence of remorse or guilt. With our nursing care, we want to set clear and consistent boundaries and limits. And we want to enforce realistic and safe consequences for manipulative behavior. Remember, the consequences that we instill for manipulative behavior cannot impinge on their patient rights. Treatment, we're going to use mood stabilization and SSRIs. Narcissistic, antisocial, borderline are the hardest to treat. Our borderline, our characteristics are going to be emotional liability, up and down. This is the one that I describe as, I hate you, don't leave me. They are very self-destructive and can use self-harm on themselves as either a suicide, they can be suicidal, or as a manipulation tactic. We have impulse control issues. So once again, that's going to make them a danger to themselves and others. That's splitting, where there's no in between. You are good They also have a intense fear of rejection and a intense fear of being alone. Once again, we're going to want to provide clear, consistent boundaries, clear communication, and calmly review the therapeutic goals for redirection. We may use mood stabilizing medications, CBT, dialect behavioral therapy, or schema-focused therapy. Histrionic characteristics are going to be excitable and dramatic. These individuals are going to be very high functioning. They may have some bold external behaviors that are very attention seeking and can be provocative. These patients have a lot of lack of insight. So our nursing care, we need to make sure that we keep our interactions professional. We don't feed into flirtatious behaviors. We promote concrete and safe behaviors and appropriate behaviors, and we promote self-confidence. This is going to be the best treatment of choice is going to be psychotherapy. And then our narcissistic, we are going to have feelings of entitlement and self-importance, and that is because of a negative self-esteem. We're going to be hypersensitive to criticism and have a constant need for admiration. When caring for these clients, we want to remain neutral and avoid power struggles. We're going to role model empathy, and we may use lithium and CBT for treatment. All right. And then our cluster C is our anxious or fearful. So for our avoidant personality disorder, we are going to have a low self-esteem with shyness and reluctancy to engage. We're going to have a fear or be preoccupied with rejection, humiliation, and failure. We do not want to push these individuals. We want to respect their, we want to help them socialize at their own pace. We want to use a friendly, accepting, reassuring approach to try to kind of help break them out of that shell. We're going to use assertiveness training, trust building, anti-anxiety, and antidepressant medications. Our dependent personality disorder. We have submissiveness, fear of separation and abandonment. They're going to manipulate others into taking responsibilities so that they don't have to. And there's going to be intense anxiety when left alone. This person is going to find their quote-unquote person and attach to them. When they don't have that person, they are going to be extremely anxious and cling on to the next person they can find. So we want to help address current stressors, set limits that don't make them feel punished, and help them with their assertiveness training. And we're going to use psychotherapy for this. For obsessive compulsive, it's just like our obsessive compulsive disorder. This is just a personality disorder. We have that rigid inflexibility. There are going to be standards for others that just don't align, rigid and inflexible. And there's going to be an unhealthy focus on perfection. Routine is critical for these guys. They cannot handle unexpected change. So if we know the schedule is changing, we need to tell them as far in advance as possible to help them manage that. And of course, we want to provide structure that includes time to complete any kind of rituals. And we're going to use group and behavioral therapy. And then there's a nice little sheet that just summarizes all 10 of those in a cute little box. And that is our personality disorders.